ASMR anatomy series. This is going to be kind of the shoulder girdle part 2, just a building off of our last episode in the series. So as you may remember, just kind of a brief recap of where we were at before. We covered some of the joints of the shoulder and their relationships. So like the AC joint, which is the acromioclavicular joint, which is the juncture of the clavicle and the acromion, which has the subacromial space underneath it, the glenohumeral joint, the sternoclavicular joint, and then there's a few different aspects, a few different views here. We talked a little bit about the musculature in the area, and we're going to get a lot more into that over the next few videos, because we're going to get into the actual muscles in the region. So just something to kind of look forward to. I guess real quick before we go any further, another thank you to those of you who take the time to watch, those of you who subscribed so that you know when the next videos are coming, and for those of you who comment and request or weigh in on new content. I appreciate you all. Now, we'll go ahead and get right into it. So where we effectively left off beyond, of course, these relationships is, we talked a little bit about the clinical cases here. If there is an issue that, an issue with these relationships due to injury, so you have the strict bony relationships, but then those bones are held in proximity to one another by all these different ligaments, like the acromioclavicular ligament and the coracoacromial ligament, and the conoid ligament, which is called that because it has a nice little cone shape here. We can see trapezoid ligament, shaped like a trapezoid. That's why. And then, of course, we went over the clinical boxes again that have some of the degrees of injury that can be experienced here. So grade 1 is the stretching of the acromioclavicular ligaments. Grade 2 is a rupture of the ligament itself. And then grade 3 is a complete dislocation of the acromioclavicular joint. There's a rupture of the acromioclavicular and coracoclavicular ligaments. Now, I actually, in college, in athletics, experienced this one right here. I experienced a grade 1 sprain. Got hit on the shoulder pretty good, and it kind of bumped my clavicle up a little bit, and that's something that I still have to this day as far as a bony feature. Thankfully, it doesn't cause any pain. It's just, I guess you could call it a battle scar. But continuing on, we've got the joints, getting in more into the joints. Specifically, we talked about the glenohumeral joint over here, and now we're going to take a specific look at that glenohumeral joint. Now it's called glenohumeral for a reason. You've got the glenoid cavity, which is this feature right here, and then you've got the head of the humerus right here. So glenoid, humeral, head of the humerus, humeral, glenohumeral joint. And again, the acromion, the coracoid process, the clavicle, all of these are bony features that you can palpate that can kind of orient you beyond just straightforward knowledge of anatomy. And here's a posterior view. You've got the back of the acromion, the back of the clavicle. You can see the scapular spine here. So this is all the scapula. And then here's that infraspinous fossa. Of course, the humerus itself, the anatomical neck of the humerus here. And then we've got a lateral view, that acromion kind of sticking out like a crest here. The greater tubercle of the humeral head and the coracoid process, and then that lesser tubercle. Now, a couple of different things that we're going to look at here that we haven't seen yet. We've already looked at some of the ligaments as we reviewed, but here's our first look at the subcoracoid bursa in here. And when you hear bursa, the thing that I would kind of liken it to is your body's version of a brake pad, or maybe even kind of like a little bit of an airbag. It's just kind of if you remember from the spine series, which if you take a look, you can go back and check that one out. But if you go back to the spine series, there is the annulus pulposus, which was the interior core of the served as a shock absorber. It's the same kind of principle here. It's a shock absorber, so that if you sustain any kind of pressure or impact to the coracoid process, it's not going to just snap off and go into this glenohumeral joint. So all that to say, you've got a bursa here. You've got the synovial membrane, which is kind of the goo inside, if you will. And then we haven't seen this before, the transverse ligament of the humerus, which is assisting in holding the tendon of the biceps brachii long head. Now, quick breakdown of the name nomenclature here, biceps brachii. So bi means two, and seps is a kind of derivative from cephalo, which means head. So two heads of the biceps brachii muscle. This is one of them. There's another one that we'll see with different views, and we'll review that later, but this is one of the tendons of the biceps brachii. And it's going through this intertubercular groove. So it's got a nice little slot for it to extend and contract through. Here's the axillary recess. So basically, think anatomically your armpit. And then the intertubercular synovial sheath going over that tendon there. And then we also have a subtendinous bursa of the subscapularis. Alright, another look over here. Some of the ligaments we've already looked at before, like the coracoclavicular, and you can see the conical ligament there. This whole thing that looks like I guess you could say it kind of looks like a spider web of sorts. This is the joint capsule, and it encapsulates the kind of like a covering over the glenohumeral. It is the glenohumeral ligament. Overall, the joint capsule is the glenohumeral ligaments, and it's holding this interaction together, supporting it. There's that synovial sheath again, which has the biceps brachii running through it. We already talked about this before, but the coracoacromial ligament, the acromion, and the coracoid process all make up the coracoacromial arch. Axillary recess again. And let's see, is it showing us anything different over here? Not really, it's just a posterior view of the same thing that we're kind of looking at over here. Now, we've got a specific breakdown in this here portion. It's a lateral view, so we're outside looking in. We've got the humerus removed, so we can clearly see the glenoid cavity. So it's this view here without the humerus. So we're looking in, and now we can see it's a schematic representation of the ligaments reinforcing the capsule after the removal of the humeral head in the right shoulder. So we've got the tendon of the biceps brachii here. We've got the coracohumeral ligament here, the superior glenohumeral ligament, middle glenohumeral ligament, anterior band, and the posterior band of the inferior glenohumeral ligament. And then there's that axillary recess, that armpit, once again. So I hope that makes sense. This is kind of like the interior support of the glenohumeral cavity. Here's the exterior support, this fibrous capsule. Here's the interior support, these three, I guess you could maybe say four. Here's a posterior view. There is the inferior glenohumeral ligament, which we couldn't really see because it would be blocked by that head of the humerus. We can see the coracoacromial ligament here, the coracohumeral ligament. So it was transected here, but now we can see it long ways. The middle, and then thankful for the color coding here. Superior, the middle, and then the inferior, made up of these two portions, the anterior and the posterior band, which we can see pretty much more clearly here. Now continuing on, the subacromial space and the bursa. So again, subacromial space below the acromion. Here's the acromion. Part of that coracoacromial arch. What's underneath it? We've got the subacromial bursa and the subdeltoid bursa, and the deltoid muscle comes down and attaches to the upper portion of the humerus. Here we can see the interrelationship. So this is going to be infraspinatus and the teres minor. So this is the posterior of the person. This is the anterior. So the patient would be looking this way. So we've got the biceps brachii, short head, and then the long head. And as I indicated, they're coming from two different places. One of them is going to attach to the coracoid process, and the other slides right over the humerus. We've got the greater tubercle here as kind of an attachment point. The transverse ligament of the humerus helping to hold this biceps head in place. And there's the short head and the long head. And they are aptly named that because this one is longer, running the full length of the arm. And then this one's shorter, attaching to a lower portion of the humerus. So this one goes the distance, this one doesn't go quite all the way. Continuing on, we've got, let's see what our view is here. We've got a lateral view of a sagittal section with the humerus removed. So we are looking, let me make sure I'm oriented correctly. Yeah, we've got the same, this is the same picture. We're just a few slices into the shoulder here with the humerus taken out. So we've got a view of the glenoid cavity, and we can see the glenoid labrum, which is just kind of a ligamental sheath around it to make sure that these bones in relationship don't slide back and forth. I would say that it's kind of the first line prior even to the fascial attachments that help hold it in place. So there's multiple fail-safes to make sure that these bones don't slide all over the place because the stakes are quite high. So we've got the subtendinous bursa of the subscapularis over here, right under the coracoid process. Here's that tendon of the biceps brachii long head. So here's the long head here. So we're in a little ways. Halfway through that, there's the axillary recess again. But over here now, since we're further in past most of the biceps, we can also see some of the subscapularis, the lateral border of the scapula. There's the infraspinatus again. There's the teres minor in here. And yeah, I think that's everything that's new on that one. Here we have a superior view, so we're looking top down. The supraspinatus, which we could barely see here, we now can see in its fullness here, in a long way sense. The scapula, there's the superior transverse ligament of the scapula, so it's helping the supraspinatus attach to this here coracoacromial arch. Here's the joint capsule again, so it's the fibrous attachment around to hold these in relationship with one another. Here's the greater tubercle again, and the intertubercular groove, the lesser tubercle. Yeah, I think that's everything we wanted to cover there. So then we've got the subdeltoid bursa, I think is the focus of this here image. So we've got the subdeltoid bursa, we can still see that glenohumeral joint capsule. We can see it kind of faintly outlined. Again, kind of that spiderweb looking structure. That tendinous sheath again, the humerus we can see in here. So really this is the first picture where we see quite a bit of layering over each other. So we've kind of gone basic to a little bit more complex with the ligaments and the bursa, and then we've added the muscles, and then this is kind of a composite of putting them all together. We've got a subtendinous bursa of the subscapularis, and let's see, what else do we have that's of note? A different orientation, so now we've got an anterior view of that short head and the long head of the biceps brachii. We can see the teres major, which we haven't been able to really see yet. And ultimately, it's just trying to demonstrate the location of the bursa. Let me make sure. Subcutaneous acromial bursa. So it's got a layer above the acromion and below the acromion, so the subacromial bursa. So subcutaneous and subacromial. So it's got padding above and below. The subdeltoid. Yeah. So we've gone over all of them that we needed to. Alright, so here's a coronal section. So this is the same view as right here, but we've gotten a cross section further in. So we are looking, same view, just further in. So we've got a cross section now of the head of the humerus. humerus. We can see that subdeltoid bursa just further in. We can see inside the humerus. We can see the latissimus dorsi, which we hadn't really been able to see. And that's going to be on the back of the more on the back of the patient, because again, we're now more posterior than we were here. We can see the subscapularis in a different way. There's that labrum again that we can kind of see more clearly defined. The teres major. And there's the subacromial bursa, which again you can see is just kind of like a little airbag, honestly, designed to take and redistribute any impact or blunt force that the area sustains. Yeah, so I think that's everything that we will cover in today's video, because next time we will be moving on. We've got musculature, so we'll be getting really into the musculature of the shoulders and the arm, anterior musculature, posterior musculature. That'll be a video unto itself. So something fun to look forward to for next time. But that is next time. And right now we are in this time. And in this time I wanted to thank everybody for taking the time to watch. I hope you all enjoy it. I do not take for granted that you spend some time with me here. If there's something more you want to see, something less you want to see, feel free to comment and weigh in. If you like this video, give it a like. It promotes it to be seen by other people. And I think that's all for now. So again, thank you for watching. Hope you all have a great rest of your day.